Take you now to Capitol Hill.
Business people, mayors.
I want to take you now to Capitol Hill. There you see Senate Democratic leader Chuck Schumer. Let's listen in.
We need testing. We will not get America moving again until we have a nationwide, well thought out, well executed testing program. And this administration doesn't have one. So we proposed 25, but we originally had proposed 30 billion, but we got 25 billion. But most important, we're forcing the administration to report to Congress on what is the national testing program, involving manufacturing and supply chains, involving free testing, and involving contact tracing, because they are laggard. And you cannot tell people go out on the streets unless there's adequate testing, or the fear is that corona will come back doubly as hard as it came the first time. So we got that done, and that's very important. We got money for our hospitals. They're hurting. The hospitals that are hurting are hospitals that are treating corona patients, and many hospitals that may not be treating many corona patients, but they are foregoing elective surgery. So in my state alone, hospital after hospital is furloughing and laying off people. As I mentioned on the floor this week, St. Peter's in Albany is laying off 700, St. Joseph's in Syracuse is laying off 700, and these are not hot spots. And so we did, of the four major things we pushed for, we got three, over Republican resistance, but they knew they needed us. The one we didn't get was state and local government. We're deeply disappointed. It is not state and local government. It is policemen and firemen. It is bus drivers. It is people who work in hospitals. There are many municipal hospitals and many others who are vital. And they should not be laid off. And that's why we wanted to help state and local governments. We did get one change, just one, but it's important. We got a commitment from the President and Secretary Mnuchin that they will be able to use their state and local money that the feds are giving them, whether in COVID-3 or COVID-4, to deal with revenue losses, and that's very important. That was the second most important thing they wanted, other than more money. Now, one final thing. There will be a big, broad, bold COVID-4. For anyone who thinks this is the last train out of the station, that is not even close to the case. And the Speaker and I will begin rolling up our sleeves and working on that big, broad COVID-4 very soon and very quickly. And it's going to have a lot of stuff, too long to list, but I want to mention a few of the priorities that I have and I know the Speaker has. Election reform, money for housing. There's 3 months of rent forbearance, but what do people do after that? The Postal Service, money for a Heroes Fund. The people who are on the front lines, they should get extra money. And at the top of the list is a big, robust state and local plan. We're going to fight for that and many more things in COVID-4, which I think will be soon upon us because the nation will demand it. Speaker Pelosi.
Thank you very much, Mr. Leader, and congratulations on the unanimous vote in the Senate today on a package that we recommended 2 weeks ago. 2 weeks ago today, Secretary Mnuchin called me and he said he wanted $250 billion, $250 billion, and he wanted it in 48 hours. That was Tuesday. Then on Thursday, Leader McConnell was bringing this bill to the floor, and that he wanted our support for it. I told him that that wasn't possible. We had to have our consultation with the House Democrats about what we would propose. The next day, the 8th of April, that was the 7th, on the 8th, working together, congressional Democrats came together around a proposal described by the distinguished leader already on how we address the underbanked, how we address those in rural Native American, veterans, women, people of color, small businesses that are considered the underbanked, how they could be into the loop. Because it was a principle for us that we were not going to spend hundreds of billions of taxpayers' dollars to harden the disparity in access to capital that already exists in our economy. And this was a way to open that door. And then, of course, as the leader said, funding for hospitals and testing that he described, and I associate myself with his characterization of all of that. So here we are today, 2 weeks from that Tuesday of the request, when the Republicans and the administration replied that there was no way they were going to join us, that they had the 250, that's the way it was going to be. There was going to be nothing else. They took a defeat on the floor because the congressional Democrats stuck together, Ben Cardin and Chris Van Hollen objecting and then proposing our proposal, which is almost exactly what they passed today. So in terms of holding up the works, they were the ones who held up the works for a package that is more effective, fairer, and the rest as we go forward. And I don't, they like to say, oh, we held up. No, we didn't hold up. They held up. And now we have prevailed. This is a real victory for smaller businesses, as the leader has said, who really didn't have the banking relationships, but they don't need them under this legislation as it is passed. The one thing that we really have to insist upon in the next package is how we support our heroes. And under the framework of state and local government, we have healthcare workers, transit workers, police, fire, EMS, all kinds of public employees who risk their lives to save lives and now lose their jobs. And this is most unfortunate, and it cannot stand. They have huge loss of revenue because of what's happening to the economy. They have huge loss of revenue because of what is happening in their public hospitals and the rest in terms of other procedures. And they have enormous coronavirus cost. And we want the legislation that we pass in the next bill to reflect the need for them to have that recognized both with COVID-3, CARES 1 bill, and CARES 4, as Corona 4. We have to get our names now. Are we going to call them COVID 4? Is that going to be the standard thing? Okay, COVID 4, everybody knows what that is. And that's what we've been working with already, some of which we haven't been able to get in other bills. So under the framework of our heroes, our healthcare workers, our police and fire, and et cetera, our teachers who teach our children, the list goes on, of our public employees who are so essential to the success of our society. Under that, we want to be sure that there is safety in the workplace, that people are not laid off, that they have their jobs, they're employed, that their pensions are protected, that they are healthy, that we have the PPE to protect them as they do their jobs, and that we do so in a way that is values-based as we go forward. We're very excited about that. We have legislation, for example, the OSHA legislation, which they have rejected before, the SNAP to feed the American people, which they have rejected before, that we would hope to incorporate this. This is about the lives and the livelihood of the American people. So just on the chronology of it all, 2 weeks ago, they asked for $250 billion with nothing that has been put forth to improve the situation. On Thursday of that week, they were rejected. They said they were going to bring it up the following Monday, then the following Thursday, and in the days since this past Thursday, they have seen the light. We have a great victory for the American people, but we certainly need to do more. Our first bill on this, I'll just close with this, our first bill, 3 bills we passed in March, all bipartisan. This bill is bipartisan. The next bill will be bipartisan. That's important for us to work together. But we have to insist on the truth. On March 4th, we passed a bill that we had worked on in February. March 4th, we passed it in the House. Testing, testing, testing. The recognition that that was the key to everything. And so as we close off with this bill, as the leader said, testing, $25 billion in there for testing, for hotspots and for others, for initiatives that will enable us to test, to recognize that we must contact, we must find out the contacts that those who are tested positive have engaged with, and we have to have isolation, quarantine, testing, contacts, and isolation. That is why we're going to open up our great economy Everybody's restless. Cabin fever has set in many ways. But I'm so proud of the American people. They're so beautiful in their care about their own health, the health of their loved ones and their families, and the health of our country. Overwhelmingly, they have said they don't think we should open up before we are ready from the standpoint of the health and well-being of the American people. Again, we want to facilitate that with testing, contact tracing, isolation, treatment, prevention, first and foremost. With that, I'm sure the leader would be happy to take any of your questions.